for me, okay, you're watching the stream. Over the past few months, whenever we've been unsure about COVID-19 or COVID-19 vaccine, we've always looked to medical professionals to help us unpack the discussion. But what happens when medical professionals themselves are not sure about taking a COVID-19 vaccine? That is the inspiration for today's show. Have a look at some of the headlines that inspired us. The coronavirus pandemic, safety fears hamper India's COVID-19 vaccine drive. These stories are from all over the world, from the US, heading into Germany, other parts of Europe as well. This phenomenon, trend, idea that some healthcare workers do not and are not taking the COVID vaccine. So the question is, what happens if a healthcare worker refuses the COVID vaccine? That is our conversation for today. I'm sure you have opinions and experiences that you would like to share with us. And as always, you can just drop them in the comment section of YouTube and be part of today's program.
If you look on the internet, you will read all kinds of worrying things about the COVID vaccine. Is it safe? Has it been tested properly? And healthcare workers are no different than anyone else, and they do worry about these things. And I think the best answer is simply to look at the data. If we look at countries where the vaccine has been rolled out, we're starting to see a positive impact. And of the 40 million people or so around the world that have received the vaccine, we're not seeing any major side effects. So I'm a healthcare worker, I've been vaccinated, and I hope that other healthcare workers will do the same and protect themselves, their loved ones, and their patients.
During our conversation today, we have Dr. Ban and Dr. Madad. Welcome back to the stream. Good to have you in our stream clinic. Dr. Madad, remind our audience what you do and where you're based.
Yeah, so I'm an infectious disease epidemiologist by training. I oversee the systemized special pathogens program for a very large healthcare system in New York City, and so I am keenly aware of just the vaccine hesitancy that we're seeing among healthcare workers. And I think the one thing that I'll just quickly mention is the term healthcare workers is just so broad, right? So it's not just the nurses and the doctors and the PAs, but it includes so many other professionals. And we'll get deeper into this topic, but just want to set the tone up. The term healthcare workers is a very broad term, and we'll distill and talk a little bit more about that.
Absolutely. And Dr. Ban, great to have you back on the stream. Remind everybody where you're based and what you do.
Hi, Femi. Very nice to be back on your show. Thank you. My name is Anand Bhan. I'm a researcher in bioethics, global health, and health policy. I'm based in Bhopal in central India, and I work at the intersection of ethics and global health. So very much interested in this issue that we are discussing today.
Dr. Madad made a really good point about healthcare workers and who does that include? I'm thinking about the healthcare workers who are going to be on the front lines of the COVID-19, where they are going to be exposed to a lot of people who may well be infected. Dr. Ban, let me start with you. I saw this story here. It's on my laptop. 3,598 healthcare workers out of 8,136 selected beneficiaries turn up for the COVID vaccination day on day 2 in Delhi. And a lot of them decided that they weren't going to take the vaccine. Are you surprised?
I am surprised to some extent, but you have to recognize that health workers are also individuals who are more in tune with, a critical review of the facts, right? So here we know that we have gone through a very expedited mechanism of development of vaccines. Some of these individuals will have valid concerns about, is there adequate data on safety? Is there adequate data on efficacy? Is this the right time? Should we be waiting a little bit longer? And perhaps there is a need to do a little bit of confidence building because things have happened at such a rapid pace that sometimes there are concerns. I wouldn't often call it vaccine hesitancy. I think that might itself be a very broad term. There's a bit more nuance here because I think they are supporters of vaccine because they've seen the impact vaccines can have, but they do have some valid concerns. And I think it's important to try to address that rather than dismiss those concerns. And I think that might help build some confidence. That besides the case, there are other issues like failures or glitches with the platform. In India, it's the CoWIN platform. It's a software platform. that also had some issues. So it's not entirely the case that people were not turning up. It was also partly a platform issues. But things are picking up now. But I think there are some concerns and we need to acknowledge them.
Dr. Madada, I'm just looking at this Kaiser graph, and Kaiser is one of the healthcare providers in the United States, and they had a look at who might be more reluctant to take a COVID vaccine straight away. And healthcare workers, 29% of them may well be quite reluctant. Again, would you be surprised? Are you surprised by that percentage?
I'm not surprised because, as mentioned, healthcare workers are people too in terms of what's happening. We're not immune to the political theater that's been happening around the nation, around the world, and, very much still vulnerable to the misinformation and buying into some of the conspiracy theories. I think it's important to understand that the educational level is very different across the board. Even if you have a physician, we tend to think a physician is very educated, which they are, but no one is, updated in vaccinology. I mean, this is something that everybody's being thrown into all of a sudden. And so I think it's important that we educate the workforce generally across the board, and we want to listen to what the concerns are and address them. I think if you look deeper into some of the data, individuals that have higher education are more prone to actually getting vaccinated. So this goes back to my first initial point of the term healthcare worker is just so broad. So when you look at individuals that handle regulated medical waste, they're still on the front lines. They're still dealing with patients and regulated medical waste. But if you look at some of the educational levels, it may not be at the level of physicians. And so you're seeing more reluctancy there. I think just generally speaking, what needs to happen is we need to obviously have a very good education and communication campaign right off the bat. This should have started way before, but obviously we want to continue to look at and do things that are right. We need to make sure we understand what these issues are. It's one thing to have a survey, but it's another thing to actually talk to healthcare workers. I'm out in the field talking to a lot of our workforces, and some of the issues that I'm seeing is not just a matter of being hesitant. That term again is very broad. A lot of them are adopting that wait and watch approach. They want to get some more data. They want to see more individuals getting vaccinated before they're feeling comfortable. They also want to look at the longevity of the data and things like that. So we just need to address more through education and through peer-to-peer sessions.
Dr. Madad, do you think that people who are in the front lines and who are working in hospitals or working in care facilities, do you feel that they're being bullied right now? Those headlines like, this is terrible, this is awful, this is selfish. I'm wondering if there's some bullying going on and not understanding that you need to be kinder.
Absolutely. I think that the media oftentimes does a disservice because they put out these blanket statements, and you have to dig deeper into some of these issues. And again, healthcare workers are not, immune to a lot of the issues that the general public is seeing. And so just to put a blanket statement of, healthcare workers should know better, that's not the case. As I mentioned, everybody has a different educational level. We want to really make sure that we're empowering people, building confidence in the vaccine, both for healthcare workers and the general public. Because one thing we know is that healthcare workers, physicians, nurses, they're not only important in terms of treating patients, they're also ambassadors and messengers of the vaccine. So patients come to them, and a recent survey shows that 85% of the general public trust their own healthcare provider for vaccine information. So if they don't have that information, if they're not educated on vaccinology and everything that's happening, they can't really have that discussion with their patients.
Okay.
So really, really important that we address it.
I want to share something on my laptop, and then I'm going to play a little video, and then I'm going to get you, Dr. Bam, to react straight off the video. So this is the story that jumped out at me. This is from Dr. Shapiro. She says, this is a great piece. Sad that this even needs to be said. And it's an op-ed, a doctor's view. Healthcare workers who refuse COVID-19 shots are selfish. Judgment right there. And I have to be very honest, we tried to reach out to a number of healthcare workers, medical professionals, doctors. Would you be on the show and tell us why you're not immediately happy about taking the COVID-19 vaccine? They wouldn't even be on the show. They were very uncomfortable about saying it out in public, which is why we reached out to a pharmacist in New Zealand who gave us this comment anonymously. Have a listen, have a look.
I'd like to give some insight to the feelings of hesitancy regarding the COVID-19 vaccine as one who works frontline during this pandemic. Being a pharmacist means that I'm constantly engaging with patients and keeping tabs on the latest news and updates. But I'm human too, who's also fearful of the unknown and what can't be predicted. And I think that fear stems from the discussions with those around me, to the specifics of how the clinical trials were performed, or even how effective this vaccine is for the multiple strains that are present globally. So I think the best approach right now would be to just keep informed and take the appropriate precautions until proper clarity is given, where everyone can be guaranteed safety to a level they can trust.
Dr. Ban, would that work in India?
Yeah, well, I mean, she has a point, right? I mean, it's important to recognize that a lot of information is flowing around. That's been the case all through the pandemic, and we also know that there have been a lot of failures. There have been drugs which have been used, which were not really based on evidence. So people also have probably registered that as an issue. Now, with vaccines, there is a long history all of us have. We know that no vaccine is 100% safe. We also know no vaccine is 100% efficacious. So health workers recognize that, but I think they are just concerned that things have happened at such a rapid pace. It's a new virus. These vaccines which are being developed are also relatively new vaccines, though they might be established vaccine platforms on which they are being built. And I think perhaps that there is just this anxiety or concern that what would happen if something were to go wrong? Should I just wait a bit longer till there is more data available? Because most of these approvals are also emergency approvals of some kind or the other. So I think that's where, as Dr. Madar was saying, it's important to engage with them, listen to them, try to understand where those concerns come from, and try to address that. I think by blanket shaming them or by stigmatizing them, that's not going to work. That might actually push them further away from wanting to engage on that issue, and I don't think that's the right approach. In fact, we've learned a lot of this from our experience of dealing with HIV, of dealing with other infectious diseases, that there is an importance of engagement. You can do community engagement, you can do public engagement. It has to be built on a mutual trust where you exchange information, you trust the other person, and things, and you're transparent, and that will help build hopefully more belief in this whole exercise.
Doctors, I have a lot of YouTube comments to run by you. I want instant, fast reactions. I know you're qualified. I know you can do this. Okay, this is Nick's Course 74. Thank you for being part of the show today. So I'm going to give this to you, Dr. Madad. Some feel the vaccine has been rushed and are concerned about its safety.
Well, I think it depends on first what vaccine you're looking at. Here in the United States, we have 2 authorized vaccines so far, and no corners have been cut in terms of safety. And I think there's a misconception of looking at the timeline of a vaccine, typical vaccine development, and then looking at COVID-19. Certainly, it's been developed in a year, but if you're looking at how it was developed within that year timeframe, you're seeing the overlapping of the phases, the different phases. You're looking at the de-risking and the financial support. But if you're just looking at the data speaks for itself. And so you want to see, again, how efficacious it is, the clinical trials, and these are event-driven. So, I think the data, again, just speaks for itself.
Okay. All right. This one for you, Dr. Ban. Garlic Paste says, Indian politicians avoid taking the vaccine, so common people are avoiding taking it too. We've certainly seen in other parts of the world prominent people being filmed taking the vaccine. Have you seen that happen in India?
Well, there's been a lot of senior doctors who've taken it, people who are well known from the medical profession. Actually, there is, this whole issue of should you have politicians taking the vaccine, or should you actually be following the priority list which has been set up by the government? And the priority list right now for the Indian government is health professionals, followed by frontline workers, and then those above 50 years and those under 50 with comorbidity. So the politicians are not top of the list. They could make an exception to try to make a point, but I think it's probably best if we follow the list. They can actually be doctor politicians who can take the vaccine, and they would qualify as per the list, and they would also be politicians, and that perhaps might be the solution here.
Maybe Bollywood actors and actresses. I am pretty sure if you showed a couple of Bollywood actors and actresses, uptake would shoot through the roof. All right, let me just go to Dr. Drew Shankar. He's a medical student. I've given him his doctorate too soon. He's a New York medical student, and he's really addressing the idea of being scared as a medical professional to take the COVID vaccine. And then what do you do about it? Have a listen, have a look.
I think that some of the hesitancy amongst some healthcare workers to get the vaccine, really it comes down to a fear of side effects. Some folks worry that they're going to be sick after getting the first or second dose and that they're going to be out of work for a few days, or worse, they're going to have some kind of long-term injury to their health. And I think that the best way to combat those perceptions is to publicize examples of healthcare workers who have gotten the vaccine and have been able to return to work happy and healthy and, more protected from COVID. And I think by, spreading those examples, we can use peer pressure as a positive way to get folks to consider taking the vaccine.
Dr. Madad, I believe you have the Moderna vaccine. Is that correct? Are you using that as some peer pressure with your peers?
So we do. We have Moderna and Pfizer, and I personally received the Moderna vaccine. But I think it's really important to acknowledge the fears and the emotions. And we all have guiding principles when we talk about COVID-19 and just, how to address it. And this includes transparency, empathy, trauma-informed care, whether it's a patient or a healthcare worker, and then really going on from there. And I think, in his approach of, having local spokesperson, and it's not just doctors, right? People just say, let's just put doctors on the forefront. We want to have other people that are part of the workforce, like those that are in, dietary, in EVS, in lab, and other clinical fields that have gotten the vaccine to be the local spokesperson. And this is where that notion of peer-to-peer is important. People want to only speak to physicians because they're knowledgeable, but we want to also see examples of other people in the workforce that have gotten it, and then to talk about the safety profile. And these are, reactogenic vaccines. We need to be upfront about what to expect, that, you may have these minor side effects after getting vaccinated. So really important to be transparent here.
I want to go to Dave Ball, who is on YouTube. Dr. Ban, this is for you. The public is looking at healthcare workers to show the way, hence the pressure. I said, I'm wondering if they are being bullied into taking COVID-19 vaccine. But from a personal perspective, I know there are certain procedures, medical procedures, that I hate having done. I don't like having them done. And my own doctor says, I just had a colonoscopy this week. You should go have one. And I'm like, ah! But if my doctor's telling me I should probably have one. There are lots of awful things that you have to do. And when your nurse or your doctor is encouraging you, that is very helpful. If they're not comfortable taking a vaccine, what does that mean? What's the worst case scenario, Dr. Ban?
But certainly the worst case scenario is that, we will be facing a situation where, we are not able to make sure that we are covering those who are among the highest at risk, which are our frontline health professionals. The reason we are starting off in many countries by vaccinating health professionals is because we recognize that they are probably the profession most at risk right now. In terms of having to deal with COVID-19 patients and dealing with them on almost a daily basis. So by protecting them, we are also protecting a very, very important resource, which is critical to our response to the pandemic. Now, remember, the vaccines are extremely important, but they're only one aspect of our response. Having human resources available who can help us deal with the pandemic is also critically important. So if our health professionals don't come forward and get vaccinated, then obviously they can try and do everything else which they should be doing, but potentially we are losing out on the opportunity to protect them and hence keep our health systems up and running. And that's why it becomes important. It's also the case that if people don't turn up for getting vaccinated, we have to recognize that vaccines are in short supply right now. And, every day, if there's 100 people supposed to be vaccinated, only 60 turn up, you might be wasting a fair amount of vaccines. And I think in that sense, we don't want that to happen. Yeah. There's not enough vaccines right now globally, especially for low and middle income countries. So any waste which can be avoided is something we should be pushing for.
I'm just going to add just one comment to that. One of the things I hear often from just generally healthcare workers is that because they wear PPE in a healthcare setting and they haven't gotten infected yet, they feel as if they don't need to get vaccinated, that the PPE is already protecting them and they're good to go. But I think it's really different, obviously, to first address that and to make sure that it's not just that, yes, you're wearing PPE, it is highly effective. in the hospital environment, but we want to have as many people vaccinated as much as possible, to build up that herd immunity through inoculation. So that's one of the biggest problems I often hear in the healthcare workforce is, I wear PPE, I haven't gotten infected yet, and so I'm going to take my chances and just not get vaccinated. And that's not the thinking behind a COVID-19 vaccine partially, right? We want to make sure that we're addressing a lot of those concerns.
I love this next video comment. Dr. Barn, I'm going to get you to bounce off the back of it. This is Dr. Maria Sundaram. She's from Toronto, Ontario, in Canada, and she has such a great bedside manner. Have a listen to her and then react.
When we talk about vaccine hesitancy, we're talking about a complex set of thoughts, questions, concerns that individual people have. And that also applies to healthcare workers who are also people. So we need to ask them, hey, what are your concerns? What are your thoughts? The two biggest questions that I hear are, I don't know about these mRNA vaccines, and hey, the clinical trial process was super fast. I feel comfortable as a trained infectious disease epidemiologist looking at the clinical trial data and saying, okay, this data shows us these vaccines are effective and they're safe in the short and the longer term. They're looking really, really good from an effectiveness standpoint. This is a really good, easy choice for me to be making. And I'm very excited to get this vaccine when it becomes available to me.
There you go. If you have individuals and trained professionals like Dr. Sundam, Dr. Madad, who have themselves taken the vaccine or are going to take the vaccine, and they talk about their strong belief in the science, they talk through the evidence and say, the evidence is critically important, but we've looked at it and we are satisfied with it. I think that will probably help allay a lot of the fear. So I'm absolutely confident that the more of these kinds of role modeling that we see, the more of these kinds of messages which go out from health professionals of various kinds, as Dr. Madar was also alluding to, I think there will be a lesser concern. And maybe, you'll also start seeing more uptake as more and more health professionals start getting covered with vaccines. Adverse events will happen. I think you have to be transparent about the fact that, yes, there will be some adverse events. We need to have mechanisms to try to respond to that. If anyone has any kind of a serious adverse event, we need to have protections in place so that they can be taken care of medically, if required, compensation, etc. And beyond that, we have to recognize that we are dealing with the pandemic and vaccines are really an important component of our response. And let's try to celebrate the fact that we've managed to get science to get us so fast to a vaccine. But if we don't use it, then we are wasting that opportunity.
Dr. Madad, I want to show you something on my laptop. This is the Instagram account of the holistic nurse. And this struck us as a team. The COVID-19 is here, but is it what we need? And she's talking about the vaccine, question mark. And then she's got a little card saying, I'm not going to vaccinate myself, a little badge here, mimicking the I've just been vaccinated and the vaccination card, but the opposite message. What would you say to people like the holistic nurse who have a platform, who are sharing information which is anti-COVID vaccine, and she's a nurse?
So it's not just about the messenger, it's also about the message. And so really important to see, what the credibility is of this individual and what they've been saying from this point on or even before, and going to multiple sources. It's not just a one and done. So if you have questions, you have concerns, certainly seek, healthcare professionals that are knowledgeable, that have a track record of providing factual, evidence-based, science-based information. There are a lot of people out there, including healthcare workers, that may be, sharing misinformation and disinformation. And we want to counter that with good information and going to good sources of information. So my just take on that is just going to folks and going to credible, reliable individuals that have the background, that have the experience, and have a good track record of providing factual, evidence-based information.
Again, I'm going to show you some things on social audience so that you can see that there's an evolution in thought. This is a tweet from Sarah C. De Silvi. In all of the discussion of COVID vaccine reluctance in our healthcare communities, 90% of staff in the rural hospital have gotten the vaccine. And then another great thread from Eugenia South MDMS. She says, 3 weeks ago, I was a hard no to getting the COVID vaccine. And yet here I am. It's a thread on the COVID vaccine hesitancy from a Black doctor who believes in science. Dr. Madad, Dr. Varna, Thank you for believing in science and thank you for being part of this show. I will leave you in the hands of Lizzo, yes, I did say Lizzo, and the Boston medical staff who all have just got their COVID vaccines and they're very happy about it. Thanks for watching.
Thank you.
I do my head talk, check my nails. Baby, how you feeling? Head talk, check my nails. Baby, how you feeling? Feeling good as hell. Baby, how you feeling?